Good morning. I'm Shannon Decker. Thank you for the introduction, Kim. We are going to talk about naloxone. It's really the focus here is on opioid overdose and administering naloxone. During this training, there'll be an opportunity for you to sign up to receive a Narcan kit in case you want to have this opioid reversal drug on you. This training was developed in partnership with the Truckee Tahoe Forward Coalition, and the basis of it comes from that opioid response module from Mental Health First Aid, but it has been bulked up with additional resources locally. We're just going to very briefly talk about historical context of the opioid epidemic, what's causing the overdoses, recognizing and responding to an opioid overdose, how to do rescue breathing, how to administer Narcan, and then a little bit about MAT training. So there's a couple pieces that might be of interest to you. I've got a lot of resources that were compiled for this training that we did in June. That training is recorded and available. So if there are community members who are interested in this topic, families, and they would also like Narcan, there is an opportunity to review that previously recorded training and request Narcan. It's linked there at taholifeline.org/blog/opioid-response. But there's a couple articles that might be of interest as far as what an opioid problem looks like in a community. There's one article called The King of Boise about how a teenager started dealing oxycodone, and when he got taken off the streets as far as dealing, that his clientele were really very wealthy women in a very prominent area of town, and they became very desperate and turned to heroin. And it looks just like any other community. The other one that's of note is a series of overdoses in the town of Park City, Utah, that took place in 2016. And middle school deaths that they just were not sure if it was a suicide or an overdose. And then they lost another student in a very short period of time. And the response of that community in midst crisis. So those might be things to check out. But overall, opioids are used for pain management, and there's different types of pain. We've got physical pain, emotional, and spiritual pain. And it's everything on a continuum from acute to chronic. In the 1990s is when we had a national focus in the United States, focused on treating pain. Opioids were what was being used for treating chronic non-cancer pain. And it was really just prescribed on a subjective reporting basis. It was, I'm in pain, here's some opioids. I'm in pain, here's opioids. There wasn't a lot of education or tracking of the prescriptions. So since 1999, the amount of pain being reported remains stable in our country, and yet the sale of opioids has increased over 400%. Between 2011 and 2015, our overdose deaths tripled in the United States, meaning that we have 130 individuals dying in the United States every day. So we are more likely to die from opioids than from a car accident at this point. The primary cause of death in an opioid overdose is respiratory depression. So people stop breathing. And the naloxone is really the piece that comes back. They call this the Lazarus drug. So if you're familiar with the Lazarus story in the Bible, Lazarus rises from the dead. It really looks like we have someone who is completely gone, and by administering naloxone, it reverses that overdose. Let's see. In 2017, more than 70,000 people died from drug overdoses, making it a leading cause of death from injury-related deaths in the United States. About 68% of those involved a prescription or an illicit opioid, which is where we get that 130 people number. When we look at some of the common opioids, we have a lot here. And heroin, of course, being a street drug, but there are a lot of prescription drugs that come into play. Let's see, there's natural forms like opium and poppies, and painkillers like morphine. An opioid comes into the central nervous system and it's a depressant. It impacts our tolerance. We build up a tolerance for this type of pain. Chronic opioid use can cause anxiety. It can also cause constipation and a lot of other side effects. Combining opioids, benzos, alcohol, and other depressants causes a lot of misuse. There's also accidental exposure. That was one of the issues with the Park City situation with those middle school students, that if it was a drug overdose, students were really concerned about being exposed to the substance in school, knowing that there could be very minute concentrations of it, and that there could be skin-to-skin contact that could cause overdose. That is an issue that comes up with first responders if they come onto the scene and are accidentally exposed to the drug. Opioids have been added to other street drugs like cocaine. We've also seen a lot of counterfeit pills, which is what Kim mentioned earlier. There have been some counterfeit Percocet and other anti-anxiety medication that have been going around our community and the greater Reno area. These pill presses are pretty easy to get. You used to be able to obtain them on Amazon. I think you can still get a pill press from eBay, but counterfeit drugs are being made, on the border and within our own community. The resource page that is linked, there's a couple different blogs. There's also a podcast and a news special that came out relatively recently about what this looks like. How does someone go from crushing up whatever they can find and trying to mix it and distribute it? So there is a lot more information on how this comes to be. Right here, we have 30 milligrams of heroin. So that's typically, I think in most of our drug education, heroin was the opioid that we were most familiar with. But if we look, 3 milligrams of fentanyl is enough to kill an average size male, and it looks identical. So 30 milligrams versus 3 milligrams. Heroin is processed from morphine, which is 5 times, and heroin is 5 times stronger than morphine. Fentanyl is definitely more potent than morphine, and carafentanil is 10,000 times more potent than morphine. So it's inappropriate for humans to be utilizing carafentanil. It's best understood as a weapon. It was created, it's characterized as a weapon from the International Arms Treaty and should be treated as such. And yet it's out there and being used. Go ahead.
I have 2 questions. When the fentanyl is laced in other drugs, like, why does that happen? Like, are they doing it, is it intentionally put in there, and why? And then I'm wondering if you could talk about the skin-to-skin accidental contact. I've never heard of that before.
Yeah. Yes, good question. So why? From the interviews that have been done, it's typically not malicious. It's not like they're trying to overdose people. They're trying to make a very cheap drug that will sell. And so instead of getting their hands on, higher quality cocaine or so they might be cutting street drugs with fentanyl, so that it makes it feel like you're getting the high that you would anticipate from a higher quality substance. For making the pills in the pill press, they're doing that because they're not using, they're not using the ingredients to make Percocet. They are taking the Percocet dye cut, and they're packing it with a color that looks like that, and then they're putting the fentanyl in it so that it has some type of a feeling and makes people come back for more. But they aren't mixing it. The pill press that they're using, they're not using it the way that pharmacies use them. And they're just using a lot of fillers. So whereas a pharmacy might use a pill press to create a pill or a compound, these are not chemists, and they are not using them correctly. The combination, getting the drugs to mix evenly does not happen. Your second question, skin to skin. So these, substances could just be on the skin. They can be absorbed through the skin. And so part of the fear is, if a first responder comes in and is exposed without wearing gloves, if they're not wearing their PPE, then they could be exposed. The fear from the students was that if let's say, microscopic fentanyl was on a doorknob and they touched it, that it could be transferred. It's very unlikely that that would be taking place, like in a school setting is where their fear was, but it could take place in a home at a party if fentanyl has been, if we have a counterfeit fentanyl pill that goes into a bowl of other pills and somebody's reaching and touching it, we have no idea how much is on there. And so testing strips for fentanyl is something that can help with that. You can test surfaces, you can test the potency of the pills that someone is taking. Does that answer that, Joanne? Okay, great questions. Withdrawal from these include muscle and bone pain, diarrhea, vomiting, cold flashes, goosebumps, uncontrollable leg movements, and severe anxiety. This data comes from 2018. In most of our violent deaths or deaths of despair, our data is about 2 years old. And so I know that last week there were some updates to data. So hopefully we'll have data updates nationally at the state level and within the county level by next week's presentation. So if we get that in, I can email that out to you. But as of June, the most recent data comes from 2018. So in California, we had 2,428 opioid overdose deaths. There were 8 in Placer County, 7 in Nevada County, and 42% of adults in Placer County were participating in drug treatment for opioids, 27% for meth, and 26% for alcohol between the years of 2017 and 2018. And between April of 2019 and 2020, there were 11 cases of suspected opioid overdoses in our area that were improved by Narcan administration from EMS workers.
Hey, Shannon, I have an update that was sent from Nevada County in December.
Oh, great.
And it said we have had 17 deaths this year of Nevada County residents that have been confirmed as accidental overdoses involving fentanyl. In addition, there have been 12 accidental overdose deaths that did not involve fentanyl. That brings our total to 29.
Okay. So that's a big jump in what we had. So I know that another concern that I'm starting to see, not necessarily locally, but in the suicides that are taking place in the post-COVID response, we are seeing people starting to obtain opioids in their intentional suicides. Many times they have been struggling with substance use. Maybe they've fallen out of recovery. And so it's something that we really need to be more aware of. And so I'm glad that we've got this training and some other events that are coming up. The more awareness that we have and the more we are having our eyes and ears out for some of the risk factors, the more we're going to be able to intervene. So some of the risk factors for someone to overdose is the use of multiple substances. If they're using street drugs, if they're using prescription drugs that maybe they don't have a prescription for, the more substances they use, that increases their risk. The variation in the strength and the content of the substance that's used, either the purity of the substance or the potency of the substance. A person's tolerance level, especially if there's been recent changes, like recent weight gain, recent weight loss. Switching from sniffing or eating to injection. A person's physical health. So if they have their liver functioning, again, weight loss. Their psychological health, for someone who is struggling with their mental health. This becomes a big risk factor for them. Transient living, this means that there could be new dealers or new product in somebody's environment. And just the mentality that you know everything. can be a major risk factor. Using while alone is another pretty big risk factor. And I would say that other recent changes might be situational. Work loss, work changes, family changes are additional changes that can increase that risk factor. So if we are assessing someone for risk of harm or suicide, this comes from, again, mental health first aid. What are the signs and symptoms we want to look for? Symptoms of somebody being really high might be that their muscles are relaxed, they have really slow movement and reactions. Whereas somebody who is potentially overdosing, they have an incredibly slow heartbeat, a slow pulse, they are pale, clammy skin, their fingernails or their lips are turning blue. Somebody who might be really high has very slow speech. They might be slurring their words. Whereas somebody who's potentially overdosing, they make a deep snoring or gurgling. They call this a death rattle. Or they might have infrequent or no breathing at all. We know that heroin is a depressant, a downer, and it will impact the central nervous system and just slow the breathing down. So when the body slows down, that means the blood pressure and the breathing, the heart, the respiratory system, temperature rates, all of the internal systems slow down. And these are the signs that these changes are visible. After the initial rush or the high of heroin and other opioids, that drowsy state can set in for several hours. Many users move back and forth between consciousness and unconsciousness while on an opiate. Alternating from that wakeful to a very drowsy state. This is called going on the nod. And I haven't found a really good video that shows somebody who's nodding, but that nodding is somebody who's high. Somebody who's overdosing has a really heavy nod. They might not be responsive to stimulus. So again, that sleepy looking is what it looks like when someone's high, that extreme sleepiness, inability to awake them with verbal or physical stimulation is a sign of an overdose. So if you take your knuckles and you rub it on their sternum, that should create a response. If they're unresponsive, it's a potential overdose. But like I was saying, there are some videos out there on YouTube if you're wanting to see what this looks like, if you've never seen it. But I don't have one that I think is outstanding and stellar. Some of them are done in poor taste, mocking, people that they see in public. But it looks like we've got somebody who's standing upright. They could be leaning very far forward, kind of swaying, very unresponsive. I've seen it happen twice that I know of in public. I've seen it in a gas station, and I've also seen it when I've been knocking on doors to have petitions signed. And those are both opportunities where if I'd had Narcan on me, I could have left it behind at the scene with anybody else who was around. They didn't have the signs of overdosing, but I could see that they were really high on some type of an opiate drug.
Shannon, I have another question.
Go for it.
What are there, could these symptoms be similar to something else that would put us in a precarious situation for like if we said, oh, you are showing signs of overdose and we're going to administer Narcan, and like it's something else and that's really bad?
That's a good question. We will get to that in just a minute. Absolutely. So if we are concerned that someone is overdosing, if they are still up and they're conscious, they are not overdosing. They don't need Narcan. They might need an intervention. We might need to call 911 for a response, but we wouldn't be applying Narcan if they're still standing up, if they're still responding. We would only be applying Narcan if they are unresponsive. So that's a good question. We are going to talk about that a little bit more in depth. But Narcan, that Lazarus drug that temporarily reverses the opioid side effects. So it will require medical attention even if you get a positive result. We've got someone who's unresponsive. We believe that they're overdosing. we administer Narcan, we still need to call 911. Narcan is safe to administer. California and Nevada both have Good Samaritan laws that cover what's required. Those are linked on that resource page for you if you want to review them. It can be used with anyone who might be at risk, whether it's prescribed opioids or any other type of substance use disorder. It will only reverse the effects of opioids. And anytime that we use it, we do need to call 911. So the question is, what if you come upon someone and you're not sure if it's an opioid overdose or they've had a seizure and they're not responding, or they've had a heart attack and they're not responding? Naloxone is not going to cause any side effects that will hurt them. If I thought I had my Narcan up here. It's in the car. If I wanted to, I could give Narcan to myself right now. It's not going to do anything. I would still take myself to have medical attention just to ensure. The idea here is anytime that we use naloxone, we call 911. When I received this training, it was from a group in Ohio. Ohio had a very, very serious opioid epidemic. They had refrigerated trucks lined up to handle those that overdosed and passed. And so I had this training was developed by the state of Ohio in conjunction with the National Council for Behavioral Health. And they said, if you want to, you can come up here right now and give it to us. There's nothing that's going to happen. We will go get medical attention afterwards. And so if you're ever concerned that perhaps it could be an opioid overdose, we say, go ahead and administer it. If we see the signs of an overdose, if we come across someone who is unresponsive, call 911 and then administer naloxone. There's different kinds of naloxone. There's the injectable naloxone with a syringe and a vial. There's an auto injector, kind of like an EpiPen. There's an assembly required nasal spray. So you spray you twist the little spray piece on. There's the ready to use Narcan spray, and that is the one that we have available to you if you'd like a Narcan kit. It comes in a 2-pack so that you can apply the first, and if there is no response after about 2 to 3 minutes, then you can apply the second kit. And then we want to put that person into the recovery position. And so we are going to watch a video on how to apply Narcan.
Can I ask a quick question?
Yes.
So you were saying the Narcan, it sounds like, when in doubt, use it. It wouldn't harm the person.
Yes.
Are there any what would that look like in a person? Would it, like when we think of when we administer EpiPens and different things, so that if there were things that presented in the body, what might we see?
Say that question one more time.
So if I heard you correctly, if you give the Narcan, it's not going to harm the person, as in they may need it for an overdose, or I might be wrong, but I'm leaning to it might be an overdose. So I'm not going to take a chance.
Yes.
Let's say the person didn't overdose. How would that present in their body?
If they did not overdose, like let's say they've had a seizure and they're unconscious and you give them Narcan, nothing will happen. We've already called 911. We've got response on the way. This person's going to get help. You can provide whatever assistance you can at the scene. You can clear the scene. You can look for a medical alert bracelet.
Okay.
If they're not responding, either they're in an incredible overdose where Narcan isn't helping, or it's something else. And unless you're trained as a first responder, you're not going to know the difference.
Okay.
So we're using our whatever first aid skills that we have on hand. If you're willing to respond, if you don't want to respond, that is your call. But if it's someone and you feel empowered, if you feel trained to respond, we're going to treat this the best that we can. If we have Narcan on us, we can apply Narcan and hope that it is an overdose and that they're revived. Being revived from Narcan doesn't mean that it's going to last forever. Sometimes it can revive them for 10 to 20 minutes. They need to go get medical attention to have more treatment to really reverse the side effects. We're going to watch this video and then we'll talk about what it looks like when they start to revive.
Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name. Kevin. Ask if he or she is okay. Hey, can you hear me? Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not...
I'm going to pause it right there to just say the state of California requires us to say call 911 first and then apply Narcan. Clearly, if Narcan is creating this video, it can be done either way, but California requires us to say call 911 first and then apply Narcan.
Substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril.
Okay. So we try to wake the person. We want to shake them. We can we can push or pinch them. We're trying to get them to respond to stimulus. If they don't wake up, we want to call 911. This is possible overdose. This is coming across maybe somebody who's just unresponsive. If we are not sure about injury, we don't want to push them too far if we're concerned about head, neck, or back injuries. We want to give our location. We can put the 911 on speaker. If they are not breathing, you can give 2 rescue breaths and then administer 1 dose of Narcan nasal spray.
So
if I'm concerned about somebody who might have overdosed on opioids, I personally am not going to give rescue breaths. The state of California does have rescue breathing as part of their recommendations. When I have spoken with, or when I've had trainings like mental health first aid trainings with EMTs or police officers in the course who have actually administered Narcan, they suggest calling 911, applying Narcan, and then moving. If this person is really overdosing and the Narcan reverses it, they're going to come out of an incredible high and they're going to be in a lot of physical pain. So the rescue breaths might be something I would do if I came across someone and I wasn't sure if it was an overdose. I wasn't sure if it was something else. I'm new to the scene. It's not like a party where I think that there is an overdose and there are substances that I could come into contact with. Or perhaps I carry one of those CPR rescue masks, which I don't. But the rescue breathing is something that is suggested, but not necessary. Joanne.
So how do you decide whether, I mean, I know that there's, if you're at a party or whatever, but like, how do you decide not to do CPR?
You would do CPR. I mean, if they don't have a pulse, you would give CPR.
Okay.
Most of the times when we're applying Narcan, most of the times they still have a slight pulse and they tend to be breathing. If they're not breathing, if they have no pulse, then you would apply Narcan and give CPR. Good question. If you're trained to do that, again, you could be trained to administer Narcan and you don't have CPR skills. Maybe 911 can talk you through that. You just apply the level of first aid that you are able to give. You want to wait 3 minutes, like the video said. If there's no response, you can administer that other dose in the other nostril. You want to keep 2 doses on you. And again, you are protected by the Good Samaritan laws when you're trying to help an overdose victim, as long as we're doing everything that we can in good faith. It's safe. There's no harm, even if the person's not on opioids. There's no serious side effects. It's going to block that opioid receptor. So like those EMTs and those law officers said, their opioid receptors are just, they're engaged. And as soon as the Narcan comes in, it blocks the receptors and it pulls them into significant withdrawals. They're going to be in a lot of pain. You can give it to somebody at any age or any weight. It can be used with pregnant women and babies and toddlers. That group that trained us back in Ohio, they said that at one point, a family dog got into the trash can where there was a fentanyl patch from somebody who was on cancer treatment, and the dog went into overdosing off of that fentanyl patch, and they applied Narcan and revived the dog. So it's that easy to use nasal spray, 1 squirt, 1 dose inside 1 nostril. If it doesn't work within 2 to 3 minutes, try the other one. Again, there's other forms of naloxone. Narcan is the one that we have available to provide, but you don't need a prescription to obtain it. You can go to the pharmacy and request it. Anytime that a family member is prescribed an opioid, it's very wise. I'm trying to remember the law for the state of California. Some states have laws that require a prescription of naloxone to be accompanying any type of opioid. But if that's not the case, please advocate for your family members to obtain that, because it could just be that somebody's in a lot of pain. They are taking their pain medication and they forget how much they've taken and they take it again. So not all opioid overdoses are from partying. They're not all from, counterfeit drugs. There are some legitimate times where mistakes are made. And
Hey, Shannon, there was another question.
Yeah.
Kathy, you may want to clarify. It said CPR could have skin-to-skin contact.
CPR could have skin-to-skin contact. And so it really depends on what you're doing. Maybe the person doesn't have their shirt on and you have bare hands. That would be skin-to-skin contact. It's hard. I mean, if you put gloves with your Narcan kit, I know that a lot of us have gloves on hand now just due to COVID. That might be a really good way to keep it so that you could keep a barrier between you and any skin. Anyone can
There's another question?
Yes, there is a cost for the Narcan. The question is, did you say anyone can obtain Narcan if they go to the pharmacy and request it? Yes, it does cost money. The Narcan kit that you're going to receive costs $150. With your insurance, if you have insurance, there's a copay. So whatever the copay might be, the last time I looked, it was like $20. Different pharmacies have different rates. The last time I tried to get Narcan in a pharmacy, they were sold out throughout the entire town that I was in. So it's hard to keep the spray Narcan on the shelf in many communities. But yeah, if you have insurance, it just costs the copay. If you don't have insurance, the syringe and the vial is the cheapest, but the Narcan kit is about $150. And so if you would like the free Narcan kit, the Google form I just put in the link, it's only going to ask you your name and your school site, and I will give the Narcan kits to Kim, and Kim will disperse them to you.
Shannon, could we also get extra kits for our nurses? Because it makes sense for them to be the ones holding it. We can each have our own, but for them to kind of administer it to students would make the most sense.
Yes. You and I can connect, and you can tell me how many you would like.
Okay. Nurses, I'll be talking to you to find out what you think.
Okay. So again, with the rescue breathing, watch for the chest for breathing. Listen, you can move your ear over their mouth or nose. If there's no breathing, you can start rescue breathing. Again, this is your level of comfort as a trained first responder. This is the basics of rescue breathing. If you're not comfortable doing this, I would suggest taking maybe a CPR class, and each situation is up to you to assess and to respond appropriately. Next, you would tilt the head back and open the airway, pinch the nose, seal your mouth over their mouth, maybe with a plastic barrier. Breathe into their mouth. You can watch their chest rise and fall. One breath every 5 seconds, and keep breathing for them until help arrives. If there's no pulse, you can do CPR if you know how, otherwise rescue breathing. Narcan is going to work quickly. It should work within 5 seconds or less. You do want to stand back when they come to, because they could be thrashing. You want to explain to them what happened and that you gave Narcan and called 911. Narcan's temporary. It is going to wear off. Someone who has overdosed needs to go to the hospital. They may need more Narcan to prevent the rest of that overdose. And they can also get Suboxone at the hospital. As far as storage, it can freeze. So since we live in Truckee, one thing that you might want to do is to wrap it in bubble wrap to prevent freezing. Try not to leave it in your car overnight. Unless it's wrapped in bubble wrap, that should keep it. When the kit expires, you can use it, or you can ask for a new kit. You can come back to Nevada County. We'll have additional kits. We'll try to keep those used. Recently, there was, through all these grant cycles, they came out and said that we can go past the expiration date. So they are saying 6 months to a year past the expiration date should still be good. Worst case scenario, the drug is just a little bit weaker than it would have been. You can still apply it. It's not going to go bad where it's going to do harm. Medication assisted treatment, MAT treatment with Suboxone. It is a partial opioid antagonist, which blocks that opioid receptor. It helps reverse the effects of opioids. It's not going to get you high or higher than the more you take it. It just helps stop with withdrawals. And there's a pill form that could be taken at home 2 to 3 times a day. There is a local grant that can cover I keep saying MAT training and I don't know why, MAT treatment. It will also include counseling to help deal with the emotional pain, the anxiety, the fear, all of the mental health components. It's legal, it's safe to use when it's prescribed in a program. Tahoe Forest has a program, and assistance for that can be made with a direct referral. The phone number is 530-582-1212. We do have a parent event coming up. So next Tuesday evening from 6 to 7:30, we're going to have Missy Purcell from Tahoe Forest, who is also a parent of teens. We have 2 youth from the community who are going to share their experience. And then we have Jonathan Lowe, Tahoe Forest's new psychiatric nurse practitioner, who are going to share the basics of teen substance use. We're going to talk about signs of use, some up-to-date research and current substance use trends, some treatment options. There will be time for Q&A, and then there'll be a call to action for community members to take this recorded training, obtain Narcan, dispose of unused prescriptions down at the police department is one place to drop those off. There is a flyer in Spanish. We can send that out to you. This event will be translated, so there will be a Spanish interpreter providing the slides and interpreting it in Spanish. Good questions. So I know that we are up on time. If you have any questions about Narcan kits, you're welcome to contact River Coyote. She is running the Forward Coalition. I can get you the kits if you take that. I'm going to put it in the chat box one more time. If you complete this Google form, we will get this to you at the school district. You could request a kit from River at that other link, and we'll be sharing the other recorded version of this training with the community members. So if you know of anyone outside of the school district that would like to have this information, we'll get that to you. Forward the flyer about the parent meeting.
Shannon, I'm also uploading the flyer into the chat box, and the training parent workshop will be translated and interpreted as well.
Great questions. So I know that we're over time, but does anybody have any other questions? I could send out the PowerPoint. It's going to be recorded. I'll send you the recording. Do you want the PowerPoint?
That'd be great to have it on hand. Yes.
Okay. Sure, I'll send it out.
Thank you.
Yeah, absolutely.
And then I'll be the point of contact for administering the kits. So when you sign up, I'll just arrange to get them to you.
Great. Well, then before we jump off, I just want to say thanks, everyone. I really appreciate you being here and your interest in this. And anytime that I present and share, I just ask that we make sure that we have resources in our phones. And so if you don't already, I ask that you take out your cell phone and you program in the suicide prevention hotline number, which is listed behind me, 1-800-273-TALK. It might not be for you and it might not be for now, but that phone number someday could help save someone's life. So unless there's anything else, thank you so much. Have a great rest of your day.
Well, thank you so much, Shannon. Thanks for everyone being here. We appreciate all this great information.
Thanks,
Good morning.
Thank you. All right, Kim, I'll put the resources together and send out a follow-up email with a link to this recording. And I guess
Okay.